Well, good morning, good afternoon. Welcome to our Nurture Conversations. My co-host and dear friend, Dr. Dana Long, and I offer these conversations in order to advance our Nurture Connection initiative. And we seek to advance early relational health to support strong, positive, and nurturing relationships and build a healthier, resilient, and more connected community. Dana, can I turn to you?
Hi, it's so wonderful to be here with you, not only Dr. Willis, but also Dr. Quinn. So, Nurture Connections is a lively stream that's hosted by Dr. Willis and myself. And our goal is really to explore the intentional and thought provoking efforts to advance early relational health, to support not only children and families and the health transformation that needs to happen in order for us all to feel connected. So this series is a fun opportunity to have meaningful conversation. We actually really hope that we all can get closer to one another. We want to know what the story of our guests are, about how they got to be in the space that they now help to lead, and how they are engaged with community partners in order to make a difference. Our experts are from across the nation, and they share their innovative pilots and their programs, their groundbreaking research, and their advocacy. So it's so nice to be here with both of you today.
Dana, that's it. Don't we have fun with these? That's for sure.
For
I really
sure.
I love these conversations, and we get a chance to bring our most trusted colleagues, our national thought leaders, our friends, our growing network of people who inspire us along our journey to advance this early relational health, this growing nurture connection movement, but also just connecting one to one. So here we are. Carrie Quinn, let me introduce you a bit. Dr. Carrie Quinn is a colleague, primary care pediatrician, executive director of Mount Sinai. You know, Carrie, we're kindred spirits, aren't we? We both were inspired by Ellen Galinsky's Mind in the Making work and the importance of that work into pediatrics. And you've taken this such an incredibly long, wonderful journey. I've really been honored to be a thought partner with you at times around advancing early relational health within your teams. Your very thoughtful and practical work, and that's what we're going to have a chance to hear about today. Carrie's work is at the Parenting Center at Mount Sinai that promotes strong parent-child relationships and early childhood development for training healthcare professionals and transforming the physical environment to make visible the importance of enhancing existing pediatric healthcare interactions with families. Her team has created that free online residency curriculum called the Keystones of Development, which we'll hear much more about. That curriculum is training thousands of residents at over 350 pediatric residency programs across the country. In addition, the Parenting Center has produced a suite of parenting resources and videos, including Caring for Your Newborn and the Sparks Parent Video Series, which is a blend of promoting social emotional development and cognitive development for medical, sleep, safety, nutrition, and guidance. The Parenting Center was created as also an early childhood ad campaign. And Carrie, I'm really interested in hearing more about that, that embedding and broadening the key messaging around all this work. Prior to that, she's primary care physician in Queens, New York, faculty practice within the Department of Pediatrics at Mount Sinai, undergraduate degree in science and business from Notre Dame, medical degree from Tufts, and then pediatric residency at Boston Children's. So, wow, we're just thrilled to have you with us today, Carrie. And maybe, Dana, do you want to get us started with the first sort of questions and prompting we're interested in?
Yes, I would love to. It's just amazing to me, Carrie, how much the Center has grown since we first spoke 4 years ago. I'm just fascinated to hear more about your journey. And so, can you tell us more about yourself and how you came to this work?
Yes. Well, first of all, thank you for having me, and thank you for that introduction. David, you summarized it so well that I'm like, what is left for me to say? But you summarized all our projects so succinctly. So again, my background is general pediatrician. So I was in private practice for many years out in Queens, and then at Mount Sinai in our faculty practice, where I was working side by side with our co-founding director, Blair Hammond, here at Mount Sinai. And it was very early on in probably 2014 that we started having conversations, and me listening into her talking with her really good friend, Eliza Pressman, who's a developmental psychologist. and they would be talking about parenting behaviors and ways to talk to parents about different situations or circumstances that would happen, and how you could help parents build skills that would be positive for many things down the road, whether that be executive function skills, self-regulation skills, autonomy. They would be talking about this, and Eliza's good friend Ellen Galinsky as well, about how could we, why is this knowledge about how children develop and what parenting behaviors help with that development, why is it not as prevalent in pediatric training as it should be? And so it was kind of a conundrum of like, wow, we have parents right in front of us in the office every day asking questions, and yet we're trained so heavily on the medical diagnosis and treatment and not a lot on early childhood development and how to promote early childhood development. So in 2014, we started really locally at Mount Sinai of training our residents. Like, how could we do a better job at training our residents here? And the Mount Sinai Parenting Center was born in that year, 2014, by saying, okay, we really need to infuse the pediatric training environment with this knowledge. And Ellen Galinsky had this, wonderful book, Mind in the Making, and all of these beautiful, clear messaging around how executive function skills develop, and again, what parents can do to help promote those skills. So we started off in 2014 as really just training the residents here, and we had in-person classes that we would go through executive function skills, and we would go through how they're developed and what the science is behind it. And the residents loved it, and they said, we really need this. We find it so valuable, but we don't know what to say to the parents. So it's great that we understand it and really helpful and interesting, but like, what do I say to a parent about self-regulation or about, secure attachment or autonomy, these really key concepts? So it was at that time that we realized there's a lot more here that could be done. So we had to move it from beyond just the Mount Sinai, local teaching, to how can we help change the field of pediatrics to incorporate this incredible wealth of science that is out there, but it's not in practice.
Yeah, thank you for that, Carrie. What made you initially interested, though? Like, what's your personal journey to how you got connected to some of those great leaders and got so invested in the work?
That's a great question. This is going to sound maybe hokey, but I feel like I feel called to do things often. And it kind of just happened. And I often flow in the direction of where life is taking me. And I felt that I had certain skills that I could bring to the table to help get this off the ground. And it was in front of me as an incredible idea to make this happen. And I thought, I think I could be valuable in helping direct and create this into a bigger thing. And so it just came about. It wasn't that I set out to do it. I was still practicing at the same time that I agreed to be the executive director as we, formed in 2014. And I thought, well, people think I can be useful and helpful here, and I feel I could be useful and helpful. Let me just do it and see what happens. And so it just came about. And its mission and vision has grown so much from the early days, but it's just been a natural growth and cadence. And I wouldn't say it was all planned out. It was just, we saw needs and we tried to fulfill the need, and then we saw the next need and we tried to fill that need. So
Carrie, we so understand that, and far from hokey, leadership of this inspiration and vision is given and journeyed with and emergent, right? It's an emergent experience that comes from heart and comes from, just as you say, both the passion and something bigger than itself. That's all that this nurture connection movement, early relational health movement's about. I mean, I would say the same thing. I would have never predicted what I'm doing. Mm-hmm. It's been an emergent experience, and then almost a calling, as you say, becomes more and more visible and more clear. How about you, Dana?
I mean, without a doubt, I agree. It's what you say. You get into the flow and you realize that this is ethically, morally where my heart is, and professionally, you align those passions and you go for it, right? Mhm.
Totally, because it has been a huge learning experience for me as well. I mean, I'm not, again, you mentioned my degree in science business. The business side was really light, but I'm running a nonprofit in a setting. We live under the Department of Pediatrics, but we fundraise for everything we do. I'm writing grants. I'm doing budgets. I'm, out there speaking, which I'm not a public speaker. So it was like, these were all skills, managing people, performance appraisals. I never had staff that I managed before. So like, it's all been learning for me. And if I didn't love it and think it was so important, I could easily see how, there'd be many points along the way that you'd be like, whoa, this is, a lot to sign up for. But I really feel that I'm motivated by the mission. I really believe we have to get all this messaging out there. And I think the pediatric space is just an incredible opportunity to reach parents with this information. So, if not all of us doing this work, who's doing it? We all need to do it. And I think collectively, we can make such a difference by all doing our parts in our communities, in the ways that we can do best.
Carrie, you struck me when you said 9 years that this work has been 9 years. I think I learned about your work from Ellen Galinsky around 2014, where she and I were in a conversation at the AAP around the Early Brain and Child Development Initiative within the AAP. She mentioned your work as the beginning of translating it into pediatrics, and then it just grew and grew. And I wonder if you could talk about its growth and influence, as you say, transforming child health practice, transforming not only the practice of in pediatrics and all that we're all committed to around nurture, connection, and partnering with families and communities, and then maybe talk about the then the messaging campaign work that you're thinking about, and then how you're seeing that grow in front of you in that effort. Love to hear that.
Yeah, sure. So yeah, it did start. So Ellen Galinsky wanted to translate her Mind in the Making, these executive function skills, which she had already created a training for teachers in the educational setting of how to help students build these executive function skills. And she said she really wanted to get it into the healthcare space. And that's what started off as this in-person training with residents. And it just, again, organically grew from there to our work with a few developmental specialists, Elisa Pressman and some of her colleagues, of saying, okay, what are what we call keystones of development? It's really all of this work in early relational health. We didn't use that word then, but we talked about what are the really key areas of a child's development that actually are influenced by parenting. So putting aside some things like temperament and other things that we might not be able to influence, which things are related to a parenting environment or that early environment of a child. And we came up with 6 keystones. So secure attachment, which is the real early relational health about the parent-child relationship. Autonomy, a child's ability to feel their agency in the world. 3 executive function skills, so self-regulation, perspective taking, and problem solving. And the last domain, which we had trouble finding the right name for, but it's really the early literacy, numeracy, and the sciences, and how to build those skills. We call it academic knowledge. But those were the 6 keystones. We said, okay, let's go and dive into the science of these 6 keystones. And Ellen had already interviewed so many of the scientists out there and said, share your science with us. And we have video clips in our curriculum from those scientists about why that skill is important, how it's developed in early childhood, and what parenting behaviors specifically influence the development of those skills. So that's half of our Keystones of Development curriculum, is talking about each of those keystones and the science behind it. And the other half was responding to what residents told us, which is, great, I can know about that, but I don't know how to talk to parents about it. So the other half, we model exactly what you could say or do as an example in a visit to model those concepts. And we go through, we brainstormed like a million different scenarios in well child visits, and just, okay, how, when you're listening to the heart or doing the abdominal exam, can you talk about sports casting and how filling your child's day with words is so important by just saying what you're doing each moment? How can we show the resident you can model sports casting? How can we talk about, you're giving a vaccine, and that's an important time to for a child to experience self-regulation and co-regulation. So how can a parent help that child calm down, settle them, comfort them in a time of need, and how is that actually building a skill that they can use later? And so we have hundreds of examples throughout the visits of how residents can discuss these concepts, they can model them, and then they can praise them when they see the parents doing these things really well. Whether that's, the way they're singing to them to settle them down, if they're scared when they walk in the room, great. Just point it out and tell the parents you're doing a great job, and this is so important for this reason. So we built that curriculum in 2017, 18. I should say our first step was actually interviewing program directors, because we did say we don't want to build a curriculum unless we know it's wanted. So in 2016, we did a survey of program directors across the country, and we asked them, do you think it's important to train residents on how to promote positive parenting in the well-child visit? Do you think you do a good job? Almost everybody, 90+%, said they think it's important, and almost none thought they did a very good job of training residents. So we saw the need for training there right away, and that's why we said, okay, let's go from an in-person model, because at first it was going to be in person and then a user guide, and you go teach it at your program. And we said, you know what the program director said they don't have faculty that are going to be able to teach this. So we said, okay, they don't have time. They also said they don't have time or money or faculty, because we asked what would be barriers to doing this in your program. And so we quickly said, you know what? Okay, we'll take care of those things. We'll make it free. We'll make it online, digital, so that it's self-directed for the residents, and we will try for it not to take additional time. So we tried to meet the needs of the programs when we created the curriculum. So it launched in 2019, and we studied it at 7, and I was amazed at how eager everybody was. Like, we wanted to study it at a couple residency programs, and people would ask us if they could do it at their program. So I would present I went to the Frontiers of Innovation at the Harvard Center for the Developing Child. I met some people there. They're like, we want to pilot it at our program. We'll do it at our program. So we quickly had 8 sites across the country that said, we'll pilot it with our residents, and we'll study them. And we did a pre-test and a post-test before and after the curriculum. We assessed their knowledge about these concepts of early childhood development. We assessed their confidence in talking to parents about these concepts. And then we also assessed their behaviors. So what did you say or do in your last well-child visit? Did you talk about parenties? Did you talk about self-regulation? We had all these different questions, and then we assessed them again after they did the curriculum. We saw an improvement in everything: knowledge, confidence, behaviors, and we saw a reduction in what they perceived to be barriers to bringing this into the well-child visit. So we were so excited about that we launched it nationally in 2019 with a concrete goal. We said we want to get to 210 pediatric residency programs, which was an ambitious goal at first, because there's 210 residency programs, but we're at 183 pediatric programs. So still a thorn in my side why those other 20 plus aren't enrolled yet. So I still plan to get to all programs to say, why are you not using this free evidence-based curriculum that can enhance well-child visits?
As you were scaling, what did you learn? What did you learn that surprised you?
Well, the one big thing that I learned that surprised us is we started showing a map of where we were across the country, and I noticed a huge gap in the middle of the country, all the rural areas. I'm like, why are we not getting to programs in more rural areas? And I don't know why I didn't think of this before, but it just struck me that they are served by family medicine programs much more commonly than they are by pediatric programs. I mean, family medicine is more rural, and we quickly realized that, you know what, we're missing a ton of well-child visits 0 to 5 if we only focus on pediatric residency programs. So we made an effort in 2020 to say, you know what, let's open it up to family medicine. We have to get out there and get to those programs and train those practitioners as well. And it was harder because I didn't know where they went. Where do they go to conferences? Who do they talk to? Like, I didn't have a handful of program directors I could go talk to. So we did a lot of digging and working, and I'm proud to say we have more family medicine programs than we do pediatric programs now. 196 family medicine residency programs are now enrolled, but it's a much smaller percentage. There's over 730 family medicine residency programs. I had no idea. So we have a lot of work still to do with family medicine. But that tells you that's kind of our big first initiative has been Keystones. We have been continuously building on that. We get feedback from programs all the time. I should say on the side, we built an entire online platform to allow for each program that each one has a champion who is in charge of educating the residents at that program. And they're the ones that actually enter in their new residents every year. They check their progress, they check their quiz scores. We have so many resources to bring it to life. We know that you can't just learn from a 4-hour video and then think it's going to just all be absorbed. We really need a champion at each program. And so that has been a requirement of ours from the beginning, is to bring this to your program. You just have to identify one person who is going to be the champion, and we communicate with them about ways to bring this curriculum to life. Sometimes people view it together in like a noon conference or a morning report. And then they might have a case or a discussion afterwards. They might talk about it in continuity clinic, where each module is about 15 minutes. They'll play a 15-minute module, and then they'll discuss the concepts in that module. We have observation tools for the faculty to observe the residents to see if they are bringing it into practice. We have breakout modules on topics that residents wanted to hear more about, sleep training, discipline, and toilet training. So we have breakout modules on those topics, just a real deep dive on how to guide parents in those very common concerns that parents bring up. So we really have tried to build out how a program can use this and really deepen the learning for the residents, so it's just not a static watch a video.
Amazing. So Carrie, does that mean that most of the residency programs where you require a champion have a faculty champion in the ambulatory divisions?
It varies. So sometimes it's a program director or an associate program director, and sometimes it's a faculty member in the continuity clinic. Sometimes it's the behavior and developmental pediatrician who does their rotation in behavior and developmental peds. It depends. In family medicine, it can sometimes be just the pediatric representative that does a lot of their pediatric training. So it has varied, but we always require one at each program.
I put a pin in that because there are a cohort of interest, which is phenomenal. You've done an amazing job of, of activating a cohort of leaders, thereby for next generation. I'm sure to the various degrees, but imagine the influence that has, and how do we support them ever further as this movement is growing? Do you do separate activities with the champions in order to facilitate their role in expanding this work? How does that work?
Yes, so we have a quarterly forum where we do a webinar, quarterly forum where we brainstorm. Sometimes it's talking about barriers, like what challenges are you having with residents? Are they completing the curriculum? What are the things that you're doing that are helping residents complete it and engage with the material? So we're learning from them, and they share with the group. And then we usually will send out a blast afterwards to those who couldn't attend the forum. Here's what we learned on this forum. Here are things that are working well. We've noticed that what does make it effective is if a program requires it. So if it's a mandated training, obviously residents are more likely to complete it if they say it's a requirement. If they have protected time to complete it, so if they really say, we want you to do an hour a week for these 4 weeks during your behavior and development rotation. We're going to carve out time for you to watch this and engage with the materials. So mandating it, requiring it, having protected time, and then just the enthusiasm of the champion. If the champion's the one introducing it and talking about it and explaining why it's so important, that can do a lot to getting the residents starting, the curriculum and getting engaged. We've also had other things. We have a research collaborative that came out of this called KeyNet, and that's Keystones of Development Network. But it's really about, we had some people reach out to us to say, we want to study if residents are really using the curriculum well in the visits with families after they view the curriculum. And so they created an observation form. They've been, wanting to study, resident changes before and after curriculum. So we're saying, great, we're happy to mentor you. We meet quarterly for that KeyNet collaborative and really just provide mentorship to residents who want to do scholarly work. It's just another way to engage and activate people around early childhood development.
That's absolutely phenomenal. Dana, you first. I have many things swirling in my mind.
Me too. We've been asking you so many questions. Thank you for indulging us and explaining so thoroughly. Before you even started talking about the research collaborative, I was going to ask you about how you've seen changes in behavior with your learners. You mentioned the data before when you talked to program directors, and 90% said that this would be something valuable. 90% said that they're not doing it and they would like some help. So what results have you found as a result of your very successful scale?
Well, that's a great question, because we have a lot of, I would say, qualitative feedback on examples of how people are using it. And what we found, just a lot of personal stories of, I didn't do this before when I was walking into a room with a family, and now I always make sure I find one thing to praise the parents on, because I know how important it is to get that positive feedback. Or I never knew what parentese was, that it was the high-pitched sing-song voice that I use naturally, but now I know it has a name, and I can share that with parents in a way that it's sharing the science with them of how that stimulates language development. So it's really a lot of those, along with the actual research that we did with the pre-post. And then we don't have results back yet from the observation form. We have interested people who want to use that observation form to do some research and seeing the differences in behaviors. Currently, we have only self-reported behavior change. So we would love to see more observed behavior change. So that's kind of on the horizon for getting that information back. But another reason we started with residents is because we have a great environment with residents. They're used to this concept of being trained and also having a preceptor monitoring them and helping them and encouraging them. So it really fit in well to a residency program. And there was a study done a while back saying that the majority of the mindset on how you practice in the future is developed during your residency. Just your mindset of what is a well-child visit. That is created by seeing how others are doing well-child visits during training. So we knew if we wanted to really change the field, you have to change when they are building their own mindset about well-child visits and what's important to incorporate into a visit. So we're hopeful that it's pouring into the workforce for primary care providers, that this new mindset change of it's not just about vaccinations and diagnosis and treatment. It's really about promoting relationships and promoting development.
That's so beautifully stated. And right in the middle of your journey came the AAP policy statement. I call it out for the paradigm shift. And I'm really curious about whether you saw any impacts at the residency level, at the faculty level, at your champions level, under the pressure that called for this paradigm shift to be relationally centric, partnering with families, anti-racist and equity-focused efforts, right, and partnering with communities. If your work, you can see that reflected in what people have come and asking and dialoguing about. I'm curious.
Right. It's a great question because we bring up that policy statement all the time. I mean, and you guys do as well. I feel like it was so important for that to have come when it did, because it just solidified all the work that all of us are doing in such a beautifully comprehensive way. And
Yep.
we found it so validating to say, yes, like this is what we want. We want a whole movement. We want everyone to say, this is important. We need a paradigm shift. Pediatric care is going to be different in the future. And I just feel like it was a pivotal time for that policy statement. We cite it all the time when we're even just trying to introduce our work to new audiences in new programs. And we're saying, look, we have a mandate now. This is critical that we train pediatricians with this new lens of what pediatric care is. Our curriculum can help you do that. We're not a solution to everything, but we have important resources that can help you train residents to do just that. So, I mean, I think Blair says she carries it around and quotes the policy statement almost like every day. She's like, look at here, look at this. And she has it pretty much memorized by this point. But I think it was really pivotal. And it's really helped. Again, we've built out other resources. I can talk about our messaging campaign or our resources for parents, but our goal is to continue to make it easier for the primary care space to deliver this information to parents, whether it's Keystones of Development, which is training them on how to do it, but then we also have tools for the environment, the office environment, and tools that they can hand direct to parents to reinforce this messaging. I'm talking a lot, so I can continue to go down the path about those resources.
You're doing great. Dana, you want to jump in? Thoughts?
As you are developing content around how to support the pediatric well check around early relational health, is there a process that you have for getting feedback from parents and like incorporating that parent voice into the curriculum that you're teaching?
That's a great question. That was a big part of our last, our most recent project, which is the Sparks Parent Video Series. And we'll talk about the messaging campaign as well after, but with the Sparks Parent Video Series, new parent feedback was critical for this. And so we decided, what is Sparks? So Sparks is a resource for families that comes from their primary care provider at each well child visit. So it's a video, it's an 8-minute video, and it's all the anticipatory guidance that a practitioner wishes to deliver to the family, but often cannot do that because either they don't know how, or they don't have time, or they just run into a barrier with that. And so often they give them the printout at the end of the visit when they're leaving. They're like, oh yeah, and here's everything else I really wanted to tell you, but I didn't have time. So we said, you know what if we take all these concepts from Keystones of Development and we weave it into all the anticipatory guidance around safety, nutrition, sleep, all of these concepts that the pediatrician and family practitioner wants to deliver to parents but might not have time. So we created this video series, and it's 14 videos that go from birth to age 5, and each one is specific to that age and that visit. Our goal is that parents would watch the video before they come into the visit, that the provider had already done their Keystones of Development so they understand the concepts. And we're priming both audiences to walk into a well child visit, primed to talk about anything that is relevant to them, but really understanding kind of their child's development and what's critical at that age for their wellness. But to do those videos, we knew it was going to be a big journey because our audience had not been parents before. It had been residents. So that's a different audience. You kind of know them well, given that we've done a lot of teaching and training. But for parents, it's really hard. Parents are, there's not a one set of parents. There's so many different parents. So we decided, first of all, we didn't want to make these videos on our own. So we partnered with colleagues across the country. So, but our two biggest partners were 0 to 3 and Healthy Steps and Brazelton Touchpoints. So we co-developed and co-wrote and co-edited this entire video series with them, plus with lots of other experts at the table. So we had both parent experts that we asked a lot of information about. How do you want to receive this messaging? Who do you want to hear it from? 0 to 3, you might know they did a huge millennial survey where they asked parents all of these questions about how you want to get information. Most said digital. Most do want to hear from an expert, but they also want to hear from parents. And they want people to share the science. They don't want to be spoken down to. They want you to share with me what you know, share the science. So we took all that valuable information and we did some focus groups with the film producer that we hired to make these videos. We did parent sessions with that group as well. And then we had experts from different providers. We had, Native American representatives, we had Latinx families, we had, experts in, or family representatives from children with developmental delays. We brought as many people as we could into the table. I think we had about 30 people weighing in from provider lenses, and then we had parent groups. But we wanted to really get as many voices heard as possible, and created these 8-minute videos, again, blending all these concepts of anticipatory guidance. And that was launched in July of last year. Well, they were completed in July of last year. We had wanted to make a Spanish version, which was very important to us now with our Keystones of Development curriculum. It's in English, it's for residents, but with parent content, we wanted to make sure we also had a Spanish version. Our initial version, we didn't think was adequate. It had a lot of subtitle translations, and we piloted it with Spanish practitioners who said, it's great, but I really don't think my family, it's a lot of reading for our families, and it's great content, it's better than nothing, but it could be better. And we took that feedback right away and said, you know what, we're investing in a fully Spanish version. So we went back to the drawing table. We hired a Spanish film producer. We hired Spanish speaking developmental psychologist who better translated our work, because we quickly realized some concepts don't even translate in Spanish, like growth mindset. She was like, there's not really a word for that in Spanish. We have to actually describe it in a different way. So she helped rewrite our scripts. Then we hired all Spanish actors, and we have live parents in our video series because, again, they wanted to hear from physicians, but they also wanted to hear from parents. So we have parent testimonies from all Spanish-speaking, multiple dialects of Spanish, different Spanish countries all over. And we think our Spanish version is better than our English version. I'm so excited about it. So that was finished at the very end of 2023. And they are out in the world, but we're studying them this year. So we have 4 sites across the country. One that's a fully Spanish-speaking site, and 3 others, rural and urban areas, where we're going to study, what do parents think of these videos? How can we integrate them into the visit where they can be part of the care? Maybe you get it with your appointment reminder. Maybe you watch it in the waiting room. Like, how do we make sure the parents can watch them and have the time to watch them? How can the provider then talk about it during the visit and bring it into the well child visit in the most productive way that works for everybody? So we've hired Brazelton Research Associates to help us study it so that it can be an independent third party in studying it too. So they are taking on the research aspect of it. We're going to be training the sites on how to use the videos, but that's going to start in a couple months. So we're excited to see, what do parents think of the videos, and what do providers think, and how does it change the relationship between the provider and the family? How does it change how the visit unfolds?
Carrie, that discovery of how does the doc-family relationship shift, both power dynamics, authority dynamics, shared experience, the strength-based elements, like, it's really critically important to learn together from. So that we'll really be excited that we'll learn with you as that moves forward. Just amazing.
Excited about that. We also have another resource, which is our newborn caring for your newborn video. And that actually also started as a discharge class, but it was for the postpartum unit. And it was everything a new parent would need to know leaving the hospital from the medical side of things. But we blended it with this relationship, how to respond to your infant? What does crying mean? What are different infant cues? How are they communicating to you? How do you communicate back with them? Skin to skin, language development. We really incorporated all the messages we wanted to get across in that early, few days with the medical. How do you know if your child's fed enough? How do you know if they are sick? What is spitting up okay? Is it not okay? All of the typical discharge information that is received blended with all the developmental promotion. And we used to do that as an in-person class where we would be training the residents at the same time, because the discharge, there was a big discrepancy in standard of care from what a private practitioner would say to a new family leaving the hospital versus what a resident would be delivering to mostly Medicaid patients leaving the hospital. And it was really a noticeable inequity in care. And we wanted to standardize not only the language and the knowledge levels, but we wanted to also make it less confusing for the parents if they were receiving information from the nurse on this and the resident on this, and then their, family member on something else. We really wanted to have a comprehensive discharge information. So we created Caring for Your Newborn. And then we made it into a video because, again, in order to scale it, you really need to digitalize it. So we made it into a video. We filmed it in our hospital right before COVID, thankfully, because I don't think we'd be able to do it again in the hospital setting. And we released it on our website, but also on YouTube. That was the first thing we did on YouTube because of COVID. And families at Mount Sinai in particular, during the March, April time of COVID, families were being discharged in 12 hours postpartum because we wanted to get them out of the hospital, and they got no discharge instructions. They were scared. They had no family around them in the hospital. They had no guidance on what to do when they got home. So we said we need to get the video out there quickly into everybody. So we put it up on YouTube, and I think we have 1.4 million views of that video now. And we're so thrilled that it's been a great resource for families. We want to make it, our goal is to make it an intentional part of discharge care, just like the SIDS and the shaken baby videos that are part of care. Why not have a positive video about how you can bond and start that relationship with your child? And how can that be a part of routine care that it's mandated at every postpartum unit? So that's on the horizon of trying to get that in every hospital.
I hear the movement building, certainly, of your good work and how much it parallels and adds to what we're just working with around nurture connection and the early relational health messaging frame, especially the critical messaging framing that is beyond just, the doc's voice, but also the environment within which families touch the health system, or be that the hospital. And I know you've thought a lot about this in this early childhood ad campaign, and I'm wondering if you talk a bit about that. And then Dana, we should talk about the intersection with nurture connection. But Carrie, why don't you first talk about this ad campaign thinking? I'm really been inspired by it in terms of that messaging thing.
Yeah, and we were that started out of conversations with the Bezos Family Foundation and their Vroom, movement, their Vroom app, and all their Vroom messaging. And they had already launched Vroom messaging in libraries and museums, of really trying to get messages about ways parents and children could engage with each other in everyday spaces. And so we said, in early conversations with them, well, why not the hospital space? It's great you're doing museums and libraries, but you know how many blank walls we have in the hospital? It's a perfect place for beautiful messaging about parent-child interactions and parent-child engagement. So we worked with them. We started in 2017, and we did a 3-year project with them where we created hundreds of messages about ways parents and children can engage in different healthcare moments. And we made it into 3 parts: did you know, have you tried, and it's science. So we built these messages about something about, did you know your baby recognizes the sound of your voice from the moment they're born? Have you tried talking out loud about everything you're doing day to day? It's science. Babies learn language from hearing your voice and lots of words throughout the day. That was not as eloquently as the actual tip is, but we created tips like that. And we really identified where we could put these tips in the hospital space. So we had them on floors, on elevators, on mirrors, on doors, on bassinets, on hand sanitizers, anywhere we could put a message. We created and designed a message, and we worked with a marketing firm to actually create the messages and brand them. And then we did 6 units in the hospital. We did the postpartum unit, the prenatal clinic, the NICU, emergency room, our outpatient pediatric clinic, and labor and delivery. And then we populated the messages, and a key component was a training that went with it for all the staff. And we said to the staff, you matter. All these moments together matter. When we collectively talk to parents about what they can say or do, or what we can say or do, think about what the difference that makes. Because everyone thinks, oh, my interaction's small. I just go deliver the food tray, or I'm just telling them their baby passed their hearing test. You know what? Collectively, we have a lot of moments that make up a parent's journey through the healthcare system. Mm-hmm. If we all did a little bit more with our moment, think of the difference that could make. So we did in-person trainings, because it was before COVID, and we had everybody write down, give me one sentence you say to families and how you would change it. So audiologist might say, congratulations, your baby passed your hearing test, and leave the room. After the training, it's congratulations, your baby passed their hearing test, and did you know they recognize the sound of your voice from the moment they're born or before they're born? Whatever it might be, they created the add-on to their moment. And that's just a collective, really get into the water of the healthcare system, that like all these moments matter, and we all have a role to play in enhancing these moments where parents are in front of us, and usually in front of us in a time that they're vulnerable, they're nervous, they're eager to absorb information of what they can do to help their child. And like, those are really powerful opportunities for us to be a part of that collective environment for a child. So we did that. It was 3 years. We studied that as well. So we studied parents' responses to the messages in the training. Did providers talk to them more about their baby's brain development, or their connection, or their relationship? And we saw improvements in the parents' experience. And interestingly, we saw a huge satisfaction increase in staff. They really felt more proud and motivated of their role in whatever domain that would be. And again, we trained security, housekeeping, lactation consultants, front desk staff, anybody that we thought had a contact with families in the 0 to 5 age range, we trained them. So the goal with the Bezos Foundation is to get that, it's called Room in Healthcare. And our goal is to get that training and those messages to any clinic, hospital, practice across the country. The Mount Sinai Parenting Center offers the training for their staff. It's now a digital training, and we do once a month training for any staff member at any office or clinic that wants to join, can join. They learn a little bit about early childhood development, and they learn about how their moment matters. And then we give them an activity about, again, how they can change their specific moment.
It's so phenomenal, especially since, the Surgeon General's last week's advisory about connection. The public health messaging of your contribution here and Room for Hospitals in healthcare, and about that nurture connection, is essential and critical for well-being, but for everybody. And then the benefit to staff, to families, of course, to children, is really striking to me. Dana, where's your mind go? What are your thoughts?
My thoughts are that Carrie's so phenomenal, that I think that this work matters so much. And I'm just so impressed about all the different facets of what you've explored, and making small moments big, the education. I just think it's really wonderful. With Nurture Connection, our goals are to build a network in order to really support early relational health, and being very focused on encouraging sort of the development and supporting of delight and joy, and understanding the lifelong health benefits of relationships to help us during the good times and the bad times, and everything that comes from having really strong, positive, nurturing relationships in early childhood. And so our work as being network builders is really to support the capacity, and to help to build really a society where emotional connection is universally promoted, like in all the ways that we interact with children. And so hearing you and what you've created, it's just a phenomenal model. And I would love that as Nurture Connection continues to grow, we can continue to learn from you.
Well, thank
Yeah,
you. Go ahead. I've learned so much. I mean, I feel like I'm so honored to be part of this network because people are doing such amazing things in different ways, and for us all to connect and learn from each other and be able to spread what we're doing, but what others are doing as well, is like, that's the power of a movement, is really the ripple effect of all of what we're doing, reaching more and more people. So I'm thrilled to be part of this.
I think we're almost, oh, I'm sorry, it's almost the top of the hour. And I wanted to be able to create a little bit of space for you to share what excites you. What's next for you?
Yeah, well, that's one thing we say here at the Parenting Center is we rarely take a moment to be like, wow, look at what we created, because we're already moving on to the next thing. So our next big push is to really move. Our biggest audience right now is residency programs and residents in training, which we think is so critical to getting this out there. But we want to move beyond that to all providers. So we've done a little landscape analysis of there's 150,000 primary care providers on average across the United States. That's pediatricians, family medicine, nurse practitioners, physician assistants, people that perform primary care visits. So we need to move from our thousands of residents into 150,000 plus practicing providers. So my goal is to get our resources that we've built and bring this movement to all practicing providers, because they care for the 25 million children 0 to 5 across the country. So if we can get to the 150,000, which I think is manageable and doable, we can then get to 25 million families and children. So my goal is to get to that 150, and we're on again, learning journey of understanding marketing. We've hired a marketing strategist to help us with digital campaigns and branding and messaging, and how do we get to that audience, and how do we really integrate this into those moments that they have with families. We have built out the unfun stuff on the tech side of things. We have a new platform that's going to be unveiled soon so that people can log in on their own. Currently, we're doing all the back end work of getting programs logged in. So we're doing a lot of the tech infrastructure to make it feasible to get to that 150,000. And beyond that, we want to share these resources with anyone who engages with children 0 to 5, even outside of the healthcare setting. So we've been doing webinars through some of our partners for home visitors, for Healthy Steps, for anyone in the early childhood leadership space. We've partnered with 0 to 3 and with Brazelton and Rapid Response Home Visiting. We did a webinar. We had 500, people there in that. So really anyone that's engaging with families in the 0 to 5 space, like how can we get these resources to them so it can also help them do their job better as well. So on the horizon, I just see massive expansion in our audience. So
Carrie, what worries you? What worries you, though, in this journey? What keeps you up at night? Not just, how do you expand, but we're in a really crisis moment in this country. Parents are really deeply struggling. The racial disparity issues that are disruptive parenting experience, but also provide opportunities. I mean, what keeps you up at night worrying about what's next?
Yeah, initially I was thinking about with the Parenting Center in our work, but actually when you frame it like that, my biggest worry is connection, which is this network, but it's really about the mental health crisis that's out there, people feeling lonely and disconnected, and they don't feel they have purpose and meaning. and how can we create better systems that help everybody feel that they matter and that they have a strong network of people who care about them. And I really think, I mean, we know it starts in the earliest years, but like, I just worry about, and then you add in all the digital distraction and how that takes away from relationships and connection. And so I really just worry about our next generation being able to have those deep, meaningful connections and relationships, and how can we help build really strong early years so that they can they can make it through that really rough time where they might feel disconnected and feel lonely and feel like they don't matter. So that all keeps me up at night.
Well, it keeps us up at night too. It keeps so many parents up at night, doesn't it?
Yeah.
And how we can lean on the platform you've generated to get the attention of all health providers about human development matters, and the promotion of positive experiences really matters. And there's a science behind it that's deep. And we're along the Nurture Connection movement exactly leaning in as to how does one ever further counter the disruptions of the relational experiences, counter some of the cultural myths about that, and also the structural barriers that make it really difficult. How do we heal our nation relationally? And, as time goes, I know we'll find more and more ways to connect those messages, and how the platforms can grow together, and making more visible, I think, is a unique and striking opportunity between us all. Dana, we need to start thinking about finish up. We got about 4 minutes left here. How do we start that, Dana? What are your thoughts?
What is healing is being able to sit in a space and have conversation and feel connected and support of one another. So I'm hoping that these nurture connection conversations are a way towards healing as we all sort of listen and can share. I just want to thank you, Carrie, for the amazing work that you're doing, and want to encourage everyone that's listening to really sit and to listen to someone's story today, and to be able to provide support to someone who might need to share or talk, or just to really congratulate someone on the great work that they're doing. And so I'm congratulating you, Carrie, for just being awesome, and I look forward to the journeys ahead.
Well, thank you. Thank you so much for having me here. As you were just talking, I was reminded of one of my favorite quotes, which I'm going to mess up as well. But when you think about all the negative that is out there, it's instead of curse the darkness, light a candle. So I think we all can just continue to do what we can to do positive things that are going to move things forward. And so that's my motto going forward.
Carrie, inspire us with the candle you've lit and carried, and the number of other people that have likewise lit their candles as a result of how yours became lit, and so many others being inspired. And, all of us as pediatricians know that hope springs eternal with the birth of a baby. And people feel it, and they long for it, and they want better. And they can begin to think about a future, and it always brings hope. And that all of our work is focused around hope building, hope generation, and hope supporting. And everything that we do, that's about love and about what Nurture Connection really matters. So, Carrie, thanks for the time of being together. Dana, always fun to be together here together. And we'll look forward to you in the audience listening in as we continue our now newly named Nurture Connections. And we wish you all well, and blessing to all. We'll sign off now. Bye-bye.
Bye. Thank you so much for having me.